Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and I'm exactly one half of the Bob and Brad team. Today, I'm going to be joined by our guest, Dr. Anuja Mathew. She's a physical therapist with a doctorate in physical therapy and a master's degree in physical therapy. She also is certified in orthopedics with an orthopedic clinical specialist certification, and that's earned by only 5% of the physical therapists across the country. She's also trained in women's health and pelvic floor. She's been in practice for 10 years. She's kind of an expert on women's health conditions such as urinary incontinence, pelvic pain, pubic symphysis dysfunction, diastasis recti, prenatal and postnatal rehabilitation. So we'll get into a lot of those subjects today. Please join me in welcoming Dr. Anuja Mathew. All right, Dr. Anuja. How do you pronounce your last name, Anuja?
Mathew.
Matthew, just like it looks like. So Dr. Anuja Mathew, thank you so much for being on our program today. So we prepared some questions. Thought we'd jump right into it. And we gave your background already, so everybody knows of your impressive background. So we can.
All right, let's jump right into it.
Sure. You see a fair amount of women with who are pregnant?
Yes, pregnant and postpartum.
Gotcha.
After their delivery as well. Yes.
Yeah. So, do you see a lot of back pain?
Actually, a lot of them. Most of them would come in with back pain during pregnancy. Some of them after pregnancy. And usually I've seen that most women will get back pain either during their pregnancy or after. It depends.
Sense.
Yeah.
So what would you say is the most common type of back pain you're seeing with pregnancy?
So most women actually come in with the diagnosis of sciatic pain. But when you evaluate them, you know that it's not sciatic pain. It's not a sharp shooting kind of pain that goes down your leg, but it is something that's called a pelvic girdle pain or an SI joint pain that kind of refers down to your buttocks, to your lateral thigh, sometimes also going down to your calf. But very rarely does it go down to your feet or your foot or the top of your foot. That's the most common type of pain presentation that I see. The other type is just general low back pain, mostly later into the pregnancy when the whole biomechanics of your body shifts. Your belly is growing bigger, there's more strain on your back. And that's just a general low back pain, which is not radiating to your leg.
So the pregnancy makes it difficult to treat.
Yes.
Right? There's real challenges.
A lot of challenges, yes. Your body's growing, all the ligaments are relaxing, they're stretching out. Your muscles are stretching out, doesn't make it easy for your body to maintain the stability it needs to.
Yeah, isn't the hormone relaxin or something like that? It's actually.
I know, it's supposed to be relaxing, but it actually causes the most problems there.
Right. Exactly.
Yeah. So, and a lot of women actually, even before they get into their second trimester, will experience low back pain or SI joint pain just because of all these ligaments stretching out or just relaxing. There's been some correlation where they say that if you have gluteus medius weakness, you might end up having low back pain because that's like the main stabilizer of your pelvis when you're walking or standing.
Gluteus medius, just for the layperson out there, it's a muscle on the side of your hip that tends to stabilize the femur too, right?
Yes.
So what else do you do for these people? I mean, for these women, can you describe some of the things you try with them or?
Yeah, so most of it actually is a lot of postural correction, the way they sit, they stand, the way they're walking. The other thing is stabilization exercises, and most of them will get better with hip stabilization exercises. Even if they do it for a couple of weeks, they're much better later on in the pregnancy as well.
Nice.
And most of the exercises are safe to do during pregnancy, and they're very comfortable. Most of them include stretches, some amount of glute stretches, hamstring stretches, and the others will include strengthening of those glute muscles. Also, then some introduction of your core stabilization or the awareness of your core muscles. And most people do it wrong. They're just, sucking in their belly, thinking that they're activating their core. So a lot of it is also integrated with breathing exercises or diaphragmatic breathing, along with relaxation techniques.
Do you recommend a belt or not? An SI belt?
So I do recommend an SI belt, but it depends. Like, the evaluation is so important. The patient should have SI joint related symptoms. If it's someone with just a regular low back pain, which is located just in their lower back and radiating out in the lumbar area, they're not going to benefit from the belt, really. But if they do have a pain where it is on their buttock or where your sacrum is radiating out on your buttocks or your pelvic area in the front, going down your thigh, if you give them the belt, you actually notice a difference immediately. Like, you give them the belt, you make them walk, they should feel a difference, at least a reduction in the pain.
Right. It's not something they grow into. I mean, it helps right away.
Yeah, it helps right away. And that's when you know that it's the pelvic stabilization that they need, which will help them with the pain. That being said, that's not the only go-to thing there. You're not just going to go get a belt and wear that and you're fine. You still have to activate those muscles that are needed to stabilize your pelvis. So
you mentioned the walking. What is it that people do wrong when they're walking that may cause the SI pain?
So even when you're walking, your pelvis is rotating right and left, right? So it's going anterior. So it's rotating forward and backward as you take a step forward. With relaxation of your ligaments, there's not a lot of movement that happens between your sacrum and your ilium, or the pelvic bone that is there. When your ligaments are relaxed, there could be a lot of movement that you don't want to happen.
Sure.
And if these people have weak muscles in their pelvic floor or in their hip or their core, that movement is going to cause a lot of pain.
Sure.
Not just with walking. In fact, most people notice it with stair climbing, when their legs are actually going in opposite direction, getting in and out of a car, even turning in bed or getting out of bed will be painful, just because of the amount of movement that happens at the pelvis and the sacrum that's not supposed to happen.
Yeah, kind of a micro movement going on, isn't it?
Yeah.
So yeah, it's interesting. I was just watching a video by Stuart McGill. I don't know if you know who he is, but he wrote The Back Mechanic. He's kind of a renowned back expert, and he was talking about doing split squats with weight, how they're finding that's causing SI problems.
It's
fine to do split squats without weight, but with weight, it actually brings on
irritates.
Irritates and stretches out the SI, just like you're kind of. So, I mean, some women too, just by sitting correctly, correct? I mean, if they kind of sit on one side more,
leaning on one side, yes. Even that could cause pain. Even just prolonged sitting could cause that kind of pain.
Yeah, it's the problem of society. I mean, lots of walking, correct? I mean,
yes, walking is always good. Even more than just walking, switching positions or changing positions. If you're standing for too long, sit down. If you're sitting for too long, stand up and walk.
Good point.
So to avoid something that's sustained for a long time.
A static position, you want to avoid that. Yeah. So with the belt, do you ever just squeeze on the ilium?
So it's usually the way it's worn is you stand up upright, and it's worn right above your trochanter, or where you feel your pelvic bone there, and it's very low. It's not on your belly. It's right below where your belly ends. You stand with your feet together, you put it on, you're not really squeezing it tight. It has to be comfortable. You should be able to sit with it comfortably. And you can take it off when you're sleeping at night. But you're supposed to wear it throughout the day.
Gotcha, makes sense. Now, I'm assuming that you get to see the diagnosis of sciatica a lot because people think as soon as the pain is spreading out that it's sciatica. Is that what you think is going on?
Yeah, most of them, yes. Even people, they just come in and they say, "Oh, I think I have sciatica," because the pain is going. Even if it's just in their buttock, it's sciatica for them.
Exactly. Do you have it?
Honestly, to say only 1% of pregnant patients with low back pain actually have sciatic pain. And that could be related to something they even had before pregnancy, unless there's a real herniated disc there that is causing the sciatic pain because of the change in your muscle strength and everything later
on. Any other common pain that you see with pregnancy that you treat?
Yes, so there's also a pubic symphysis dysfunction or the pubic bone pain that I've seen in a few patients. It depends on the onset of it. Some patients have had it even in the initial, like in the first trimester, but most of them will have it later on in the trimester when it's actually stretched out more. And this pain is usually in the front it's right under your belly. It's on your pubic bone in the front. And it could radiate.
Comes around and attaches right in the front.
Yes. So it's right in the front. It could radiate into your groin area, into your inner thigh, or it could also radiate to your lower back. So that also could cause lower back pain for you. And these patients, you know immediately that it's a pubic symphysis pain. It's very specific. They'll say that they have pain when they stand on one leg or they're climbing stairs. It's like they feel like a clicking or something moving. That's another kind of pain that we see.
They'll feel the pain, the clicking in the front. I mean, they can
front and also in the back. They also complain of clicking in the front or the back. And usually this pain will go away postpartum. Only a few women will actually have this pain even postpartum.
Sure.
But for these kind of patients, yes, the stabilization works, but for them, it's also avoiding a lot of things. And if it gets really, really severe, then the only thing they can do is rest because it is that bad and it is that painful and severe.
So really stop.
I have seen a few patients with that kind of pain. Luckily, it hasn't been that severe that they had to go on complete rest. The belt helps. All the stabilization exercises definitely help. Also, if you have a weak pelvic floor, that's one of the reasons why it could also cause it. So helping with your pelvic floor.
We'll be talking a little bit about that later, but so you have them do the pelvic floor exercises and that often helps.
Yes.
Sure. Does it, when you do the pelvic floor exercises, what length of time do you normally see? Does it take to see some benefit?
So during pregnancy, we're actually not looking to strengthen something a lot because everything is stretching out.
Sure.
During pregnancy, you're just trying to maintain and prevent anything that could happen later on.
Sure.
So we're not, also when we do get a pregnant patient, very rarely would we do an internal exam for them unless it is actually advised by their OBGYN. So it's more to do with getting them an awareness of their pelvic floor, where it is. And during pregnancy, more than actually doing the strengthening, it's also important for them to relax it because that's what's going to help them during labor. So if you're just doing strengthening and tightening and increasing the tone of the pelvic floor muscle so much and not relaxing it, then you're not helping it during your labor. So
hypertonicity in there. The muscles get fired up and they won't relax, and that pain, that's pain itself. So
Yes. So later on in the pregnancy, it's more about when you contract the muscle to feel the contraction, but more than that, to also feel it come back to the resting position, or to feel it come back into a relaxed position where you feel it stretched out or relaxed and not just contracting it.
You may mention this later or talk about this later, but do you use any biofeedback with people who have pain like this?
So I, in my clinic, don't use biofeedback at this moment. I used to initially in my practice. Now I usually just use tactile feedback, more of their own awareness, which has actually helped more than biofeedback. I'm not saying that you shouldn't be using it. There are practitioners who use it very successfully. But with me, I felt that I did better with the patient. The patients did better with more tactile, verbal, or their own awareness of all these things.
Well, it makes sense to me, because then you can bring it to your own home. I mean,
yes,
continue it anywhere, you can get feedback. So